Hi, everybody. Amy Conley here with United Way of Door County. Today we are talking with Christy Wisniewski. Christy, you want to introduce yourself to everyone?
Hi, everyone. My name is Christy Wisniewski. I'm a geriatric outreach specialist with Door County Medical Center's Memory Care Program.
Wonderful. And today we are here to talk about the Memory Care Program and to talk about the services that this program through Door County Medical Center provides to our community. So, Christy, can you give us an overview?
So the Memory Care Program started in 2011 with our memory clinic, and that was in response to understanding that older adults were just not receiving dementia-specific diagnoses, in part due to the cost of healthcare and our geographic location needing to go far in order to get that specific diagnosis, and just lack of understanding of dementia-specific evaluation. So with the support of United Way and other grants, we have been able to develop the Memory Clinic as well as other services such as educational presentations and workshops that increase dementia awareness throughout the community and also connect people with opportunities and resources that address caregiver strain or support in daily living. So our memory clinic or memory care program is made up of a number of people. We are a team, and that team is made up of internal medicine and geriatric doctors, nurse and social work care managers, occupational therapists, and myself, geriatric outreach specialist. And our overall goal is to empower people with understanding and information so that they are able to access a better life despite coping with challenges that come with cognitive changes.
Okay. And Christy, you said dementia. You didn't say Alzheimer's. Can you explain the difference in those two words so people understand that a little better?
Sure. So dementia is a broad umbrella term for a number of symptoms, cognitive symptoms that impact a person's ability to function cognitively or intellectually on a daily basis.
Okay.
And those would be impaired symptoms. So impairment in ability to remember, or even impairment in ability to communicate or problem solve. So it's a group of symptoms.
Sure.
Alzheimer's disease happens to be the most common irreversible cause, dementia-related disease. So it causes dementia. And it's most common in older adults. So we're very, very fortunate to have this program here in Door County because Door County happens to have one of the largest older adult populations in the state.
Mhm.
So Alzheimer's disease, just to give a little more background, primary symptom with Alzheimer's disease is short-term memory loss, and it expands and gradually progresses to the point where the person is impaired in most cognitive functions and requires moderate to complete support by the end of the disease process.
Okay. So we're really talking about all types of cognitive functioning and any age, right?
Correct. The beauty of the memory clinic is to help people understand what could be causing their cognitive impairment so that they don't jump to the conclusion that this is Alzheimer's disease. Very often, cognitive impairment can be caused by, a metabolic imbalance or a medication side effect or a mood disorder or a vascular condition. So we want to try to tease all of that out in order for the person to take action and to do something about it before it worsens or exasperates. So we try to get people in early and get diagnosis early. And we are able to do that by offering memory screening free of charge in the home environment rather than having to come into the clinic or any agreed location. And we have opportunities to meet at all of our satellite offices at our clinics throughout the county. As an outreach specialist, I'm able to travel to people's homes and to other locations in order to better understand what is going on. And I also meet with care partners to understand the needs that they have and the concerns they are facing and connect them with the resources and information in order to continue to provide the best care they want to.
Good. That was going to be my next question, that this is really services for that whole family unit, whatever that family as is defined uniquely for each individual.
Right. And I'm a big believer in collaboration. So I like to develop sort of a net of support for both people who have memory loss and care partners so that they have someone to call on whenever the need arises. Dementia, and particularly Alzheimer's disease, is very complex, and there's just no way you can take in all the information at one sitting. So to have that network of support with all of our community's resource providers very much means that the person can continue to maintain a good well-being and quality of life.
Wonderful. So if people are listening to us and they're thinking, maybe this is me or maybe this is a family member, how would they reach out to you or someone else at DCMC to get that first step scheduled?
Mhm. There's a lot of ways to go about it. People can actually contact me directly. Everything I do is free of charge, so I'm more than happy to just have a conversation with someone, or we can schedule a visit. You don't need a referral from your doctor, but most often referrals come from our doctors,
Sure.
so that works too. But they can call me directly. My number is 920-746-3504. That's my office number. And if I'm not the right person to talk to, I usually can connect them with another provider or another community resource. But usually we start by setting up a visit where I meet with the person who has memory concerns and go through about an hour of questions where we're just trying to figure out what could be causing these memory changes. And then I do some very simple memory testing. And with all of that information, we decide what to do next. Sometimes it's having the person come in to meet with our full memory clinic team, which
Mhm.
is in Sturgeon Bay at Door County Medical Center's clinic.
Okay.
And sometimes that information just goes back to the person's primary care provider for follow-up. So, we can be very flexible. Again, it's very affordable. If they come into the clinic, it's typically a Medicare covered service.
Mhm.
Um, and it's very efficient. Our memory clinic visit is 2 hours long. And hopefully, if we have all the information necessary, we can offer a diagnosis and recommendations by the end of that visit.
Wonderful. Well, this is such a great service because, as you said, Christy, we have the largest or second largest, depending on the week we look at the data, oldest population in the state. So we want to make sure that everyone living here in Door County has the best quality of life. Um,
Absolutely.
and those early diagnoses, having those early conversations can really help people live their life to the fullest.
Absolutely. I couldn't agree
Well,
more.
thank you for all that you do. So, we've been ending each one of these conversations by switching to the topic of ALICE. And
Mhm.
ALICE stands for Asset Limited, Income Constrained, Employed. And we know that this is, a third of our Door County population is living paycheck to paycheck. We know that obviously if it's older people, they're not necessarily employed, but we know that many of your clients are on a fixed income. Is there a way that your services are supporting that ALICE population?
Absolutely. So we are aware that older adults within that ALICE demographic are having to make the tough decision of whether to get a evaluation of either cognitive changes or just in general healthcare changes, health changes. So the beauty again of our memory care program is we can offer that evaluation free of charge. So we don't even have to worry how they
Right.
fall economically or geographically.
Mhm.
And then we also want to make sure that they are connected with resources that will continue to support their goals and their needs when they do have a diagnosis. So connecting them with the most affordable or the most reasonable resource that will get that need met despite being in that ALICE demographic.
Wonderful. Well, thank you so much. We appreciate everything that you and your team do, and it's always a pleasure talking to you. Thanks,
Thank,
Christy. We'll talk to you soon.
thank you, Amy. Bye-bye.
Bye bye.